Hi, my name is Marbel, and I'll be your daughter's nurse today. I'm here to do a head to toe assessment, and if that is okay by you, okay, I'll pull for privacy, and then I'll go ahead and wash my hands and put on my gloves, and I'm going to identify the baby's wristband to that of the mom. And from here, I'm going to do the APGAR score because this is normal for every newborn babies. We have to do this first. So the normal APGAR score for newborns ranges from 7 to 10, and also this APGAR score is going to help me to identify any abnormalities or breathing problems in the babies. This is like generally the baby's health. It will make me identify all those problems because I'm going to be assessing the heart rate, the respiration rate, the muscle tone, and the reflexes. So we're gonna be looking at all of this in the baby. And then from here, I'm going to be checking for the weight of the baby. I'm going to put the baby in the weight pound and weigh the baby. The normal weight is supposed to be between 5 pounds and 8 ounces to 8 pounds, and to 8 pounds and 13 ounces. And we have to report if there is anything regular, from which we will find out from the pregnancy, if it was a normal pregnancy or a term pregnancy. Now from here, I'm going to be moving to the length of the baby, and how I'm going to measure this is that I'm going to measure from the top of their head to the bottom of their feet, and while laying in a supine position, and that is how I'm going to get the length. And the normal length for a newborn is between 19 to 21 inches. Now I'm gonna go to the general appearance. And here I'm going to be assessing the baby's body and looking for uh, looking for signs of like looking to see if the baby is symmetrical and well nourished without any signs of cyanosis. And so basically what we'll be looking at is to see if baby is pink all over, just like we see baby here is pink all over. And the baby should be able to maintain flex position with tightly clenched feet like we see right here. And just like it was explained, babies should not be laying like right flat. They should be kind of flexed because that's the position in which they were in the abdomen. Okay, from there I'm going to be checking for to see if the baby is able to cry. That is a good cry, by the way. And this usually happens after birth because this helps to clear their lungs and nostrils, maybe for any extra fluids as they pass through the birth canal. And then from here, I'll be checking for this cry to make sure that it's not high pitched. Because if the baby is crying in a high pitched manner, there should be there should be that should be some signs of maybe something is wrong with the baby. From here, I'm going to move forward to do my vital signs on the baby, and I'm going to be auscultating the heart rate epically and this has to be for 1 full minute. The rhythms should be regular, and I have to report any murmurs to the provider. And also, the normal heart rate should be between 110 to 116 breaths per minute, beats per minute. And also, the normal respiratory rate. I'm going to be looking at the baby's chest, making sure there are no retractions because that can be a sign of a breathing problem or some respiratory distress. So I'm going to be looking at that respiratory rate, which should be between 30 to 60 breaths per minute for a term baby or a normal baby. And this should be done also for 1 full minute. I will assess the baby's temperature, and this has to be done auxiliary. So basically, I'll have to place my thermometer like right into the armpit right here, and not like that, to pass it through maybe. So I will check that temperature, and the normal temperature should be between 97.7 to 95.5 degree Fahrenheit. And the long sounds should be clear. If there is any abnormality in that, like maybe there's some wheezing, then I'll have to report to the provider. So right now I'm going to move forward and assess the baby's head, and I'm going to assess the baby's head as I expect to see a normal round head right here. And why I check to see that, sometimes some baby have elongated or cone heads. This can be due to maybe passage through the birth canal, and for some babies it will adjust with time. And also I'll measure the baby's head circumference, so I'll have to pass a tip like right here, and around the baby's head. So the normal baby's head circumference should be between 33 to 35.5 centimeters. That should be the normal baby head circumference. And then from here, since the baby is already presenting to me with a head, I'll go ahead and check the posterior frontal. That should be a triangular shape. That's the posterior, but first I'll start with the anterior. And the anterior frontal should be, I should be able to touch it, so that should be palpable and also soft and flat. And it should be closing at 12 to 18 months, and then it should have a diamond shape. Anything other than that, we will have to report that to the provider. Also, I would like to check for the posterior frontal. That should be triangular in shape and should close within the first 3 months of the baby being born. So that is really something we should be looking at for, to make sure that we are not missing that, because that can be something that will cause problem probably in the future. So after that, I'll be looking at the suture line. The suture line normally runs from the front of the head through the back, and we want to make sure that it's well aligned and approximated. And I will have to report any sunken fontanelles, as that could be a sign of severe dehydration. So now I'm going to go to the baby's face. I will assess the face for any signs of jaundice. Meanwhile, I'll look at amelia. That is something that is common. That's a common finding in newborn babies. So that shouldn't be a problem, but I'll have to report any signs of jaundice. I'll go to the baby's eyes, and I want to make sure that a normal finding of swollen eyelids, which is okay for newborn babies. Probably this is caused as they pass through the birth canal, or pressure that they endure from the birth canal. Also, I will use my pen light to flash in the baby's eyes. I want to make sure that the baby's pupils should be equal and reactive to the light. And also a red reflex should be present. And if not, then I'll have to report to the provider, as this may be a sign of congenital cataract. So I'll move to the baby's ears. I'll assess the ears for flexible pinna, and that also should be aligned when an imaginary line is drawn from the ear to the outer canthus of the eyes. So like right here, it should be aligned. If it's below, then we have to report, as that may be a disorder. So I will assess the baby's nose. I'm just looking at it. I don't want to see the baby being in discomfort while breathing. So I'll assess for the baby's nose for any nasal flaring and report to the provider. And also the nose should be flat as well. So I'll move to the baby's mouth. I am going to assess the baby's mouth by putting a gloved hand into the baby's mouth. And as I put my gloved hand into the baby's mouth, I'm checking for a suck and gag reflex. And I'll also be checking to palpate the palate to ensure that they are intact, because the suck reflex should be strong as well. This will this will be an observable trait for a healthy newborn. And while I'm still at this area of the face, I'll just check for the rotten reflex. So I'm gonna stroke the baby's cheek, and if the baby turns towards that direction, and then there is a presence of the of the rotten reflex, which is good. So I'm gonna go towards the neck, and here I'm going to make sure that I find a short neck, because that is normal for babies, and I want to make sure that the head that is sitting on the neck is able to move freely in a full range of motion, and that there shouldn't be any masses when I touch at it. There shouldn't be any masses or webbing at the neck area, and the clavicles should be intact. And also the clavicles are like right here, we call them sometimes the neck bone. So I want to make sure that they are intact, and report any fractures. Okay, while we do this, I'm gonna move to the chest because I'm just around the area. I will assess the chest, and it should be a barrel shape, and the xiphoid process should be prominent as well. The chest movement should be equal and bilateral. So if I watch like the breathing of the chest, I shouldn't see like any unequal level on the part of the chest. So while I'm still here, I would just like to measure the circumference of the chest. So I'll place my measuring tape around the baby's chest, and usually the normal circumference should be between should be 30.5 to 33 centimeters. Going down, I'm going to be assessing the abdomen, and the baby's abdomen should be a dome shaped and protuberant, so it should be kind of a little distended. That's normal for newborns. And the bowel sounds should be audible, so the bowel sounds should be present after 2 hours or within 2 hours when the baby is born. Also, the abdomen should be soft and easy to palpate without any masses. So if I'm supposed to palpate the baby's stomach, it should be soft, and I should be able to palpate that. So from here, I will check for the umbilical cord. The umbilical cord should be without any redness or drainage or swelling. When any of that is found, then I'll have to report to the provider as well. And just not forgetting the baby's stomach, it should have 3 verses, as I mentioned. So with the umbilical cord, it should not have any drainage, no swelling, no redness. And then I'll just go ahead and measure the abdomen circumference. And the abdomen circumference for girls should be 24.92 centimeters and 24.47 centimeters for boys. I will assess if the baby had the first tool, and that first tool is called the meconium, as this is very important. This first tool has to be passed within the first 24 hours of the baby's life. If this is not done, and then we have to report that to the provider. Now I'm going down. I'm going to be checking at the genitalia. I'm going to assess the baby's genital to see if baby has voided within the first 24 hours of life. The urine should be light, pink or orange color with no odor, as that is normal for newborns. So the baby's genitalia for both male and female may be swollen, and there can be a present, or there may be a present of white cheesy secretions, which is normal for newborns. And the female clitoris should be completely covered or engorged. And if there is any presence of pseudo menstruation, that is normal for girls. And also, we assess the ureter of the boys to make sure there is no presence of hypospadias. And when we see this is a situation where the urethral lines below, just below the penis. So we have to report that to the provider if we see that. And then we have to assess to make sure that the testicles are descended, as when we find any undescended testicles, and then we have to report to the provider as well. Now I'm going to be checking for the hip placement, and from here, this is how I check for my hip placement. The baby's feet like that, and to make sure that there is normal range of motion. So just like that. And make sure that that is intact as well. Any abnormalities, then I'll have to report to the provider. Now I'm going to be checking for the extremities, and checking for the extremities, I'll have to check for muscle tone and make sure that the baby has a good muscle tone and can maintain flexion. And also, I'm making sure that there is full range of motion. There should also be 10 fingers and 10 toes. So if we have any extra digits, and then I'll have to report to the provider. Here also I'll want to assess and make sure that the baby's palmar and plantar reflexes are active. When baby's digits grabs my index like that, when I put my fingers in the hands and they grab it, that is a good palmar reflex. And on the toes, when the baby's toes can engulf my fingers and hold onto it, that's a good plantar reflex as well. Those are very important. If those do not happen in newborns, and then we'll have to report it. And then I'll assess for the Babinski reflex, and this is when the baby, when I stroke the heel of the baby through the lateral side towards the foot, and the baby will spread the the little finger and the little toe and the big toe in like an open opposite directions. That is a good Babinski reflex as well. And also I'll be checking for moral reflex, and this moral reflex I will have to report. And this is how I'll check for moral reflex. When I hold up the baby, I want to see that the baby is able to support himself, probably with the head, or just holding tight to my hand, like knowing that, hey, I have to struggle to do something. So that is a good moral reflex. Anything less than that, and then I'll have to report to the provider. The baby's nails should be soft and flexible. They are newborns, so they have soft and flexible. If I don't find that, or I find any of them missing, then I'll have to report to the provider as well. Now I'm going to be moving to the spine. And with this, I want to hold my baby like that. As I place the baby like that, I want to make sure that the curvature of the spine is straight, without any abnormalities. And I want to make sure that the baby is comfortable in that position and it's not uncomfortable. In the spine, I want to make sure that there's no sacral dimples. I want to report those if I find them. There are no masses or any opening. At the same time, I want to make sure, because any of these things can cause a spinal bifida if the baby's curvature is not straight and flat in the future. So from here, I'm going to be checking at the baby's anus, and with the baby's anus, I want to assess that around the bottom area there are some Mongolian spots, which is normal, and make sure that the anus is patent, like the baby can be able to pass out stool without any problem. If that is absent at that moment, we have to let the provider know. Okay, I'm going to be checking at the stepping reflex, and with the stepping reflex, I'm gonna hold my baby up and make sure my baby is able to support himself with his feet. And if he's able to do that, and then that's a good stepping reflex. And if that is absent, or the baby is just wiggly, and then we'll have to report that to the provider as well. All right, from here, I'm going to swaddle up my baby, because I'm done with the assessment. I'm going to swaddle up my baby and make sure that he's comfortable, because I'm sure I'm sure that he must have been very uncomfortable through the process. So sorry, I don't have enough space here, but I'll put my baby like that. Some baby are so calm when they're swaddled up, because some of them like it, some of them don't. Anyways, so I'll swaddle up my baby and then hand the baby to mom. I'll make sure that baby is calm, and then I'll take off my gloves, I'll wash my hands, and I'll document or report any findings during my assessment. That is my assessment video. Thank you.